Okay, here comes a video about antidepressants. Okay, antidepressants may be thought of as anti-life. Could they be thought of as anti-life? Okay, first of all, antidepressants often kill sex life. 70% of people who take them get problems with their sex life. 7 out of 10. Also, the more strong feelings for loved ones also have a problem when you take antidepressants. People don't care anymore. It kills feelings. This is what people often say, that it took away my feelings for everything, my enthusiasm. And it can make people killers. A lot of people have committed murder while they're starting antidepressants, stopping antidepressants, or actually just taking antidepressants, and some of them have been acquitted because of involuntary intoxication. And more people kill themselves on antidepressants than when they are not on antidepressants. At least a doubling of the risk. In industry-sponsored trials, God knows how much it would be if it was totally neutral trials. This is on carefully selected patients who are not suicidal from the beginning. So they are not representative of normal patients because they're not suicidal. And they have better follow-up, which gives people more hope, which makes them less suicidal. More contact, more attention. And the placebo group is actually going in cold turkey off their previous antidepressant, which makes this very scary research. They are in full abstinence, going cold turkey, which usually creates relapse according to the industry-sponsored trials. Relapse trials, they take people off the antidepressants and see that they get a lot of problems. And suicide attempts are miscoded as emotional lability, for instance, or overdose. So it could be at least 600% increase of suicidality on antidepressants. This is very serious. This is especially on the medication called Seroxat or Paxil. Many say it kills the personality. Then we have withdrawal reactions from these medications. They can be very, very hard to stop. Many say the abstinence is worse than the abstinence from heroin, and then we know that this is serious stuff. Heroin has a much shorter abstinence period. The SSRI may last for several years, so it can be very dangerous to start these medications. The doctors will usually say that your disease is back. But people get many new symptoms. Even people who took it for anxiety, they become depressed when they stop. They get brain zaps, they have problems controlling their eyes, and they took it for anxiety, but now they got depression. And they become suicidal. Okay, so a very good book about this is called The Chemical Imbalance Delusion. Because doctors often say that taking medication, taking drugs for depression is like taking insulin for diabetes. And researchers say that this is a fairy tale. And many doctors have admitted it's not the science, but it's very good for the patients. Lie to patients to make them take their drugs. It has never been shown to be any chemical imbalance. And Terry Lynch has written a whole book about this called The Depression Delusion. Thousands of references. So, can we trust the people who talk about chemical imbalance? Can we trust them with anything? They don't want to show the research data. The trials are clearly rigged. And they are judging their own trials. So, especially the thing that it kills your sex life. Not good. So that was very quickly about antidepressants and the way they can be quite anti-life. And the most important thing is that they don't really work. They're not really better than the placebo. If you take an active placebo that gives you some side effects, the antidepressants don't work better.